Hello and welcome. Today we'll be exploring tic disorders, neurological conditions characterized by sudden, repetitive, non-rhythmic movements or vocalizations called tics. We'll delve into the causes, symptoms, diagnosis, and management of these often misunderstood conditions. The exact cause of tic disorders remains unknown, but research suggests a complex interplay of genetic and environmental factors. Genetics play a significant role, as tic disorders often run in families. Specific genes haven't been definitively identified, but researchers are actively investigating potential candidates. Environmental factors, such as prenatal exposure to certain substances or infections, and autoimmune reactions, may also contribute to the development of tic disorders. Current research suggests an imbalance of neurotransmitters, particularly dopamine, may be involved. The pathophysiology of tic disorders centers around the basal ganglia, a group of structures deep within the brain involved in motor control, habit formation, and reward processing. It's believed that dysfunction within the basal ganglia circuitry, affecting the connections between the basal ganglia, the thalamus, and the cerebral cortex, leads to the production of tics. This dysfunction disrupts the normal filtering of sensory information and motor plans, resulting in the involuntary expression of tics. Neuroimaging studies have shown structural and functional differences in these brain regions in individuals with tic disorders. Dopamine, a neurotransmitter heavily involved in basal ganglia function, is thought to play a crucial role, with increased dopamine activity potentially contributing to tic generation. Tic disorders affect people worldwide, with varying prevalence rates depending on the specific disorder. Transient tic disorder, characterized by tics lasting less than a year, is the most common, affecting up to 20% of children at some point. Chronic motor or vocal tic disorder affects approximately 1% of children. Tourette's syndrome, the most well-known tic disorder, affects around 0.3% to 0.9% of children. Tic disorders typically begin in childhood, between the ages of 4 and 12, and are more common in males than females. Tics are the hallmark of tic disorders. They can be simple or complex. Simple tics involve only a few muscle groups and are brief, such as eye blinking, shoulder shrugging, or throat clearing. Complex tics involve multiple muscle groups and are more purposeful, looking like hopping, touching objects, or repeating words or phrases. Tics can be motor, involving movements, or vocal, involving sounds. Before a tic, many individuals experience a premonitory urge, an uncomfortable sensation that is relieved by performing the tic. Tics can fluctuate in frequency and severity, worsening with stress, anxiety, or fatigue, and lessening during focused activities. Some individuals can temporarily suppress their tics, but this often leads to a build-up of the premonitory urge and a subsequent increase in tics. Diagnosis of tic disorders relies on clinical observation and a thorough medical history. There are no specific blood tests or brain scans that can definitively diagnose the conditions. A physician will assess the types of tics present, their duration, frequency, and the age of onset. It's important to rule out other conditions that can mimic tics, such as dystonia, chorea, and myoclonus. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, provides specific criteria for diagnosing different tic disorders. A diagnosis of Tourette's syndrome requires the presence of both motor and vocal tics for at least 1 year, with onset before age 18. Tic disorders are classified based on the type, duration, and combination of tics present. These include a transient tic disorder, characterized by one or more motor and/or vocal tics present for less than 1 year. Persistent chronic motor or vocal tic disorder, involving either motor or vocal tics, but not both, present for more than 1 year. And Tourette's syndrome, defined by the presence of both multiple motor tics and one or more vocal tics, though not necessarily concurrently, for more than 1 year. There is also a category for other specified tic disorder and unspecified tic disorder when the symptoms do not meet the full criteria for the other disorders. Treatment for tic disorders focuses on managing symptoms and improving quality of life. Many individuals with mild tics do not require treatment. For those with more bothersome tics, behavioral therapies, such as comprehensive behavioral intervention for tics, or CBIT, are often the first-line treatment. CBI teaches individuals to become more aware of their tics, identify triggers, and develop competing responses to prevent tics. Medications, such as alpha-adrenergic agonists and dopamine-blocking agents, may be used to reduce tic frequency and severity. However, these medications can have side effects, so they are typically reserved for individuals with more severe tics that significantly impact their daily lives. Deep brain stimulation, or DBS, is a more invasive treatment option that may be considered for individuals with severe treatment-resistant Tourette's syndrome. In addition to specific tic-focused treatments addressing co-occurring conditions such as ADHD, anxiety, and OCD is essential for comprehensive care. Currently, there are no proven ways to prevent tic disorders, because they appear to be a neurodevelopmental disorder based upon genetics, environment, and autoimmune reactions. There is no definitive way to prevent someone from developing the illness. Further research is needed to identify modifiable risk factors that could potentially reduce the likelihood of developing a tic disorder. The prognosis for tic disorders varies. Many children with transient tic disorder experience spontaneous remission. For those with chronic tic disorders, symptoms may persist into adulthood, but often decrease in severity over time. Tourette's syndrome is a lifelong condition, but the severity of tics often fluctuates throughout life. Most individuals with tic disorders can lead full and productive lives with appropriate management. Recent research is exploring new therapeutic targets, including other neurotransmitter systems and immune-related mechanisms. Studies are also investigating the potential of neurofeedback and other neuromodulation techniques to improve tic control. Continued research is essential to better understand the causes and develop more effective treatments for tic disorders.